I usually get a very high-pitched panicked voice on my telephone when this happens, and the first thing I say is, just calm down, let's talk about it, and not worry so much right away. Positive as a result of an exposure. So there is a vaccine for hepatitis B. If you are unvaccinated and you have exposure through a needle stick with hepatitis B, it's as high as 30% to become positive yourself, which is why we encourage all healthcare workers to get the hepatitis B series. It works, it's great. If you're vaccinated, you can see it's less than 0.01%. So it's very, very low. It's so close to zero, we're calling it zero. Hepatitis C, there is no vaccine. And we have had exposures and conversions to positive from hepatitis C. The other bad thing about hepatitis C exposure is there's no antivirals available for hep C. So unlike HIV, if you had an exposure and the patient was positive, we'd put you on antivirals. For hepatitis C, there is none of that. It's not zero. HIV, even with a high-risk patient, in a hollow core needle, it's only 0.3%. Of course, once again, if you get it 100%. So we want you to report all of these with antivirals right away, like within the first 2 hours. It is very close to 0.01% again. Blood splashes to your eyes, nose, and mouth is a very high ick factor. It's when you get blood in your face or in your mouth or in your eyes, there's a lot of panic that happens with it. But don't worry about it. It's not that much. It's less than 1 per 1,000. Once again, though, it's not zero, so you should be reporting it. And then in intact skin, there's no known reports of conversion. The effects of transmission is devastating. You've heard some about it earlier today. You develop the infection and the AIDS disease or hepatitis C or hepatitis B, there's possibility of transmission to your family, your partner, and it will impact your health, your family, and the rest of your life. So we want you to be very careful when you go to work. What do we have in place to keep you safe? It's called personal protective equipment, and it's standard precautions is what we've called this. Now, you might find when you go to work that there'll be some old policies and they call it universal precautions. These days we call it standard precautions, and it's all about putting a barrier between you and the fluids of the patients. And it's very important that you wear personal protective equipment. All blood and bloody body fluids may contain harmful viruses and other bacteria or other diseases. And we don't test everybody. Early on in the HIV pandemic, there was a lot of discussion about just testing everybody and putting the people who were positive away so that they didn't expose everybody. And some of you don't remember that, but those of us who have been in medicine for a long time do remember it. And the truth is there's people who are positive out there right now. It's okay. As long as you protect yourself, it's not a problem. If it's wet and it's not yours, you need to wear a pair of gloves or protective equipment of some kind. Gowns are available. Most of them are fluid resistant, not fluid proof. So a large amount of fluid is not going to stop them. But you can take that gown off and your clothing isn't exposed or isn't contaminated. Anytime there's a possibility for a splash to your face of any kind, it's just good to get a mask on with a face shield. And by the way, glasses are not considered personal protective equipment because they don't really protect your eyes that much. You can get a splash through the top. So you must wear either goggles or a mask with a face shield. And then the bottom line, the most important part of all of this is sanitize your hand and make sure that you're not contaminating your hands and carrying that around. So this is a graphic about how to put personal protective equipment on, and there is a sequence of events that has to happen. The first thing you do is you put on the gown and you tie it in the back. A gown that ties in front really doesn't help you. It needs to be tied in the back, and then you put on the mask with the face shield, And then you put on the goggles if you don't already have a face shield on that. And the last thing you do is you put on your gloves. And then you can go into the room or take care of your patient. And it's a very simple process, and there is a process for taking them off, and it's just the reverse. So the first thing that comes off are your contaminated gloves. So it's all about reducing your exposure. The gloves come off first. Gel your hands, this would be a good time, and then the goggles and the face shield and the mask, and then the gown. No, the mask comes off last. So the goggles come off first if they're separate, and then the gown, and then the mask comes off. And then the last thing you do, because your hands touch some contaminated surfaces on all of those items, you need to gel your hands once again. And that's all there is to it. It's not that hard. It's all about prevention. Hand hygiene is the best thing you can do. Personal protective equipment is very important that you actually wear it. Your employer has to provide that, and all at no cost. So you need to find it as soon as you get to your new job. Make sure that you find where that is and that you understand how to put it on. You must use respiratory etiquette. And in this day and age, when we have this pertussis outbreak, some of you already know this. It's simply about covering your cough. So if you were to sneeze or your patient was to sneeze, you'd expect them to cover their cough, just like this. Using your hands is not good. Why is that? Because you've just contaminated your hands. And if that should happen, and sneezes happen at the least opportune time, if you cover your mouth or cover a cough with your mouth, with your hands, then you need to gel your hands and just clean that, because you're spreading that everywhere you go from there on in. Instruments need to be a lot of instruments where you work, and there should be a policy on handling instruments and making sure that they're cleaned properly, and that once they are contaminated, that they're handled properly to put you at minimal risk for getting an exposure. All sharps must have a safety device by law, especially here in Washington State, but it's a national law too. To use a non-safety device needle is against the law. So if your employer doesn't provide it, you need to talk to them and see that they get that in. And if they can't do it and they won't do it, then, this is one of those things you can report to OSHA about. Biomedical waste needs to be contained. That's the bloody tissues and bloody gauzes and everything. It needs to go in a red bag, biomedical waste, and it needs to be disposed of properly. And your employer needs to have an exposure management policy in place. And we need to use standard and transmission-based precautions when you work. So this is transmission-based standard precautions, and we're going to talk about transmission-based precautions later on. This is the law, OSHA, bloodborne pathogen standard, in every facility that takes care of patients needs to follow this, and you have this available to you to go and look up. This is how to find it. The CDC has guidelines for isolation precautions in hospitals, but it also covers ambulatory areas. And it's not a law. The CDC is a guideline type of place. It's not a law. But any facility who takes care of patients in any way, shape, or form will be following these guidelines. Work practice controls are there to minimize and reduce your exposure to the minimal amount possible. Ideally, as you start your new career in medicine or healthcare or whatever, and you go on for 40 years or more, sometimes less, ideally you have no exposures throughout that period of time. The last time I stuck myself with a contaminated needle was a memorable experience. It was in 1979. So yes, you can go through life without sticking yourself. It is possible. But you must modify your own behavior. Please don't, whenever you go to work, don't eat or drink near any patient area. It's just not safe. And definitely you should not be storing your food or your drinks anywhere near specimens of any kind. It shouldn't be in the same refrigerator. There's a law. It has to be separate. You must use the personal protective equipment. For instance, you never, ever, ever should recap a used needle. Use the safety device. Make sure you understand how to use it properly. And then that sharp is your responsibility. You need to dispose of it in the sharps container. If you use it, you must dispose of it. Don't expect somebody else to do that. There Here's the needle, the sharp. Never, ever, ever recap a used needle. Never. Only sharps go in the sharps container. That's healthcare has to pay extra, and it's expensive. So make sure you only put the sharps in the sharps container. Don't wait until that sharps container is absolutely full. When it's about 3/4 full, seal it up, tape it up, exchange it for a new container. Don't wait until the needles are poking out like there's a porcupine in there, because those are a high risk. And if there are instances where healthcare workers have been exposed from that. So make sure if you use that sharp, it's your responsibility. You need to dispose of it. And that goes for your coworkers too. Make sure that they do that too. It's not your job to clean up their sharps and get rid of it. Even a physician, they need to take care of their own sharps. So what if an exposure happens? The bad thing happens, and you poke yourself with a contaminated needle. Don't panic. Ideally, you'd know what the policies are where you're working before this happens. So this is your responsibility. It's your employer's responsibility to train you, but it's your responsibility to know exactly what those policies are. Don't panic. And now the first thing you do is basic first aid. Wash it out. Soap and water. Make sure that you clean it well. Don't squeeze it. Extra trauma actually spreads the virus, no matter what type of virus that is. So if it's in a mucous membrane, wash your eyes. There should be eye washes material right there where you work, easily available. It's a law. And if you get it in your mouth, just rinse, rinse, rinse. And it's all about dilution. You don't need to put soap in your mouth, and you certainly don't want to put soap in your eye. It's all about water and just diluting it as much as possible. And then the very next step is you report it to your immediate supervisor. And this goes without saying everywhere you go. They need to know what happened. And immediately the next step, where I work anyway, is you report to employee health. Now, depending on where you work, there might be one person who's in charge of employee health and is also in charge of a lot of different other things where you work, depending on how big it is. So you need to find out what that policy is and make sure that you follow it. And then the next thing would be for them to evaluate what the risk is. Obviously, if the patient has high-risk behavior, then there's a good possibility that they'd put you on antiviral drugs at this point. There are engineering and controls in place by law in every facility, and it's all about reducing the exposure. It's sometimes a pain in the neck. It takes extra time, it costs more, but it's very important. They need to have plastic bags for fluids. They need to have incontinent pads to collect fluids from patients so they don't dribble all over the floor, and they need to provide you with personal protective equipment. There needs to be a sink in every clinic where you can wash your hands. Ideally, there would be a sink with soap and water in every room of that clinic if you're working in a clinic. There needs to be sharp safety policies in place, and they need to have a place to get rid of those sharp containers to make sure that they are safely disposed of. Sharp handling, it's all about safety devices and actually using them properly. You must learn to activate the safety device appropriately, keeping your soft body parts away from the business end of any needle or any sharp. It's required by law. And any drop needle, be aware, you'd be shocked, but there are a lot of needle sticks that happen because people will try to catch a needle as it's falling. A needle with a syringe. Don't do it. Let it fall, and then be very careful the way you pick it up. A dustpan with a broom is the best way to do it. Contaminated instruments, there's body fluids on these instruments. The minimal amount of handling is the ideal situation. All sharps should be pointed in the same direction. Scissors, for instance, should be all pointing in the same direction, not just bundled together in a bin. They should be all in the same direction. You need to wear gloves anytime you handle any kind of contaminated instrument, gowns if there's going to be any kind of splashing, masks, and ideally a mask with a face shield, or wear goggles while you're cleaning, because there's a lot of splashes that happen. Every facility needs to have a biomedical spill kit. So that's in case like a tube of blood should fall and break. most tubes these days are plastic, but there are some glass ones out there, and they do break and they make a horrific mess. Don't panic, it's okay. There should be a spill kit available to you where you work. Find it before that happens so that you can just go and get that material and learn how to use it. Something to absorb the kitty litter, something to absorb the blood, for instance, is a good way to go. There should be a packet of personal protective equipment right there in that spill kit so that you don't have to go find it. There should be a way to contain all of this, like a plastic bag. That's a simple thing to do. You must clean this very thoroughly, and there's various cleaners that should be available right there at the site. And just let it air dry. Don't wipe it dry, because a lot of the viral killing material needs to air dry in order for it to work. And then the final step, hand hygiene. So in addition to standard precautions in facilities, we have additional standard transmission-based precautions. And this is added isolation and various methods that we use just to keep the transmission to a minimum. And most of this happens in hospitals, but it can also happen in clinics. And it's just a way to provide a consistent approach and a management, a way to manage patients who come in with transmission, with diseases that can be transmitted to you. Obviously, it's about containment of body substances and fluids and all of that, but some bacteria in particular and viruses are airborne, and so we need to protect not just you, but the other patients in the facility, and it works. So these are the transmission-based precautions. This is additional stuff that we need to do. And it's always used along with standard precautions. So you don't use this instead of standard precautions. You use standard precautions with every patient or every person that you work with. And then this is additional stuff. So we use contact isolation for MRSA. If you've heard of MRSA, it's methicillin-resistant Staph aureus, which is a lot of it out there. We also have VRE, vancomycin-resistant enterococcus, anybody with diarrheal symptoms. And usually, even nurses will call me and they'll say, you know, I don't know, how this patient isn't positive for anything, and, you know, and he was in isolation, and I need to take him out. And I go, well, how much diarrhea is there? Are they soiling? I always use the term, are they soiling the environment? Which means it's not contained. So if a patient can get to the toilet and is able to wash their hands, then that's okay. But if they're getting it on surfaces and it's around, it's spread around, then they need to be in isolation. Of course, anybody with large draining wounds. Droplet isolation is what we use for most viral and bacterial coughing diseases, such as influenza. Yes, you need to be in isolation if you have influenza. And you've all heard about our pertussis outbreak. So there's a lot of people out there coughing. If that person coughing shows up to our facility, they go into droplet isolation. They're considered that positive until we have confirmation that they are negative. Rubella is still out there. We don't see it very much anymore, but occasionally it will, usually in people who've traveled and are unvaccinated. But coughing of any kind needs to be in isolation simply because we don't know. And diseases show up at your clinic or at our hospital and we don't have an identification, but if the patient's coughing, we put them in isolation. There's contact airborne. This is for zoster. This is shingles, for instance, and then chickenpox, because the virus gets up in the air and we need to keep that in the room. Now, most healthcare workers are either vaccinated or they've had it, so you are immune. But we need to be concerned about other patients who have not had it yet. And then the final one, which is airborne, respiratory airborne, and that's for TB, tuberculosis, and for measles, which is highly contagious, and SARS. I don't know if you remember SARS, it was a number of years ago. We have not seen that for a long period of time. We don't know if it's still out there, but we always need to be prepared for it. So here I have some case scenarios here. So this is a question for you. So you need to ask yourself. So let's pretend that you're working in an ambulatory clinic. An adult enters the room. He's coughing because, you know, they come to you because they're sick, and he's coughing, and he's at the desk and he's complaining he's had a cough for more than a week. What do? What would be the best thing to do? Put on a mask. Put either a mask on him or you wear a mask. So ideally, the patient would be covering their cough, they'd be coughing into a tissue, or they'd obviously, you know, you should have a mask right there at the desk. They'd pick up a mask and put it on. Patients are not compliant. We'd like to think that they are, but many patients are not compliant. So the one person who should be compliant is you. So you get a mask on and that protects you. So do you know what this patient has at this point in time? No. Is it contagious? Good chance that it is. What would you do? What are they coming in for? Right away, you don't know what they're in for. So what do you do to reduce your exposure, right? Ask them to cough into a tissue. That's an easy thing to do. There's a Kleenex box there. Offer them tissue right now. Make sure that they cough. It's an education thing. Give the patient a mask. There should be masks at the desk and any clinic intake area. And if they can't be compliant for various reasons or they don't know about it, then you get a mask on. So infants, for instance, that are coughing, if you're taking care of this infant, you need to wear a mask. And that's simple. So what was it? Well, it was pertussis, and we've seen a lot of it now. We've seen 10 times the number of cases of pertussis this year than we did last year at this time. There's a lot of it out there. And so if you had PPE on, great, you did the right thing, and you don't have to take antibiotic for 5 days because you would be getting prophylactic antibiotics to make sure that you don't get it. There's a lot of it out there. So here's another one. You're in an ambulatory setting. The patient comes in for wound care because they have a diabetic foot, which means that there's open draining wounds on their feet. Patients who are diabetic very often have wounds because they have neuropathy and they can't tell if they have a sore or a wound of some kind. And very often they're very infected. So do you know what this patient has? Maybe, maybe not. Okay, but it is an open wound. Right now, hopefully they walked in with a shoe and a sock, which should be good. So you don't have to be so concerned about it. So they're coming in for maintenance for this wound. So what do you do to reduce your exposure? First of all, if you're at the desk, it's not that big a deal. You know, hand hygiene always works, not a bad thing, and encourage your patients to use that. If you're taking care of that patient in a treatment area, what should you be wearing? A mask, gloves, a face shield, and a gown, especially if there's going to be splashing. Wound care involves a lot of irrigation very often. You should have a mask with a face shield or a mask with goggles, and always gloves. So here's another case, injection clinic. So there's a lot of clinics that do like all kinds of injections for various purposes. So you need to know what your workplace policies are first off, and you need to know. You know now what the OSHA requirements are, but you know, never hurts to reinforce that and to relearn it every now and then, just to know where you are. So what are the policies? Well, they change depending on where you work and what they do. I can tell you what our policies are, but that doesn't always apply for a clinic area. Always, always, always wear gloves if you're taking care of anybody with wounds, and obviously the hand hygiene. So what do you do when you go to work and you find some place where you're working and they're not doing the right thing, or what you're not unsure? The first thing you do is say something, or ask a question, bring it to somebody's attention. Infection prevention is everybody's job. Just because I do it 24/7, I'm on call, I've got a pager, you know, I was answering email there in the back. You know, it's always important that you work as safe as possible and say something. It's your job to do that. Always use hand hygiene, always wear the personal protective equipment, and exposure reporting is if that's part of your job, make sure that you do it, and always use the barriers, and always take care of those sharps. It's because you're taking care of everybody, not just yourself. Thank you.